Mr. Hancock, thanks for joining us on the programme this morning. Talk to us about this app. A lot of people worried about privacy.
Well, it's not just an app. It's a whole system that we're launching of test and track and trace. The idea is to be able to trace the virus, to find out when somebody has the virus, to find out who they might have passed it on to, and to be able to trace the virus so that we can then defeat it ultimately and slow the spread. And that involves a combination of the testing capability that we've built up in recent weeks, the technology to be able for your phone to be able to work out who you've been nearby, and also contact tracers, clinicians and other people who are there so that when somebody tests positive, you get in contact with them and you say, who have you been near, who you might have spread it to, and then you can tell them that they are at risk. So it's a whole program of test and trace, and the app is an important part of that.
Yeah, but people don't want necessarily everyone to know where they are.
No, and of course, and the app doesn't tell people where you are. So there aren't. This has been designed with privacy concerns built in, but the critical thing about it is that by downloading the app, you are helping to trace the virus and to save lives. So I'm really glad that in the early surveys yesterday in the Isle of Wight, people were very enthusiastic about downloading it. That is what we expected, because people know that it's really, really important that we trace this virus, and because that does save lives, and these privacy concerns are important, and they're built into the app. But the critical thing is all of us are having to, the liberties as a nation that we're having to give up in order to tackle this virus are already enormous. So we're asking people to do this because it will help us to manage the virus with fewer of the big social distancing measures.
Mr. Hancock, I wonder if we could keep it short and sweet today, because I know you're on the show tomorrow, or at 10 o'clock tomorrow here on Sky News. Got lots of time to put lots of questions to you. Then let me just race through these this morning, if I may. You need people to sign up at a 50 to 60% rate in order for this to work. Why are you saying no thanks when people like Apple and Google are prepared to help?
Well, we need as many people as possible to sign up. There's value to it if fewer people sign up. We've been working with Apple and Google, and the reason that we're doing it the way we are is because we'll also then be able to spot flare-ups in the app right across the country. So that's an important feature of it, because when you have symptoms, you go and put them into the app, and we'll be able to spot where the flare-ups are.
Yeah, but why not get Apple and Google involved when they're saying, we can help you with this?
Well, we have been working with them, but the proposal they've got doesn't have that capability, and so it doesn't help us as much as what we're bringing forward.
Okay, let's move on to the TUC saying when people go back to work, not all employers will offer safe workspace. What sanctions will the government put in place if employers do not offer safe workplaces for workers?
Well, look, it's critical that employers offer safe workplaces. And we've been working with employers, large and small, and with the trade unions on getting these details right. I know there's further discussions going on this week, so that as and when more people can get back to work, there's guidelines, there's rules in place to make sure that workplaces can have safe distancing and social distancing in the workplace, like many already do. Like, for instance, I might normally come into the studio to have this interview, and instead we're doing it over Skype, and I'm at home.
But what sanctions will be in place? What sanctions if people don't, if employers don't keep their workers safe?
Well, there are discussions, as I say, about those, and there's a draft set of proposals, but I don't want to prejudge those discussions that Alok Sharma is leading with both the unions and well, there's already rules in place that we've brought into to deal with the crisis. Yes, and it's about how we make sure that the rules that exist and the guidance that exists both works practically on the ground for employers and also keeps people safe.
And what about employees who still feel that they're not safe and don't want to go to work? They could lose their jobs, couldn't they? The government can't protect them in that regard.
Well, we can protect people by having the rules in place for social distancing at work and people doing the very best they can to follow those rules. And these are really important discussions that are going on about how we can make that work in practice, because people do need to get back to work because the economy is vital for so many things, and including funding public services. So it is important, but it's got to be done in a safe way. It's got to be done in a safe way.
Something has to give as far as the furlough scheme is concerned. I just read an article that said that as a country, we're paying half the wages of the nation at the moment. Do you think that furlough will be extended? Next time you have a chat with Rishi Sunak, what are you going to say to him?
Well, Rishi was clear yesterday that there won't be a cliff edge, but as you say, we also need to get people safely back to work so that we can withdraw from that scheme. It's been very, very successful in keeping jobs there, keeping people employed, and keeping firms alive during this incredibly difficult period. But we've also got to wean off it as the economy gets back on its feet. So it is a really difficult balance. It's something that I know Rishi is working very hard on. He was very clear yesterday that there won't be a cliff edge, and I think that's very important.
Why have you changed your mind on the advice to over 70s about staying at home?
We haven't. We published the advice several weeks ago, and that remains the advice.
Yeah, but you did tell them that they should be staying at home, didn't you?
Well, the advice to the over 70s we set out in detail on the NHS website when the social distancing rules were brought in, and that advice remains exactly the same. Now, I know there has been some media debate about this in the last couple of days, but the rules haven't changed, and they're really clearly set out. There are essentially three groups of people. The first group is those who are clinically extremely vulnerable. They have a specific condition, means that they're very susceptible to this virus, to being ill if they catch this virus. We call them the shielded, and and every one. I
understand that, Mr. Hancock. Sorry, if I could I know that we're sort of tight on time, so forgive me for interrupting. But the government said clinically vulnerable people. Item 6: clinically vulnerable people are those who are age 70 or older, regardless of medical condition. It's okay to change your mind, but I just wondered why you had.
I haven't. And if you'll forgive me, I'll continue answering the question because I was just about to come on to that.
Do.
The second group is those who are clinically vulnerable because the nature of this disease, including the over 70s and others with some conditions, for whom we say they should pay particular regard to the social distancing rules because of that vulnerability. And then there's the rest of us. So there are three groups, and we have a different set of different strength of advice for the three different groups. We set that out from the start, and I'm glad to have had the opportunity to set that out again for you. It's worth going and reading the nhs.uk website about this, Kay, because it's really important to get right and not to confuse people, because I do want people who are over 70 to be confused by the media between the first group I described. Second.
Okay, well, I thought I had read it meticulously. I'll go back and have a look at it again ahead of tomorrow. Meantime, are you going to be wearing a mask anytime soon?
Well, again, on that, the government guidance has not changed. We're constantly reviewing the scientific evidence. And the scientists say that the evidence one way or the other on the wearing of masks outside of health and social care settings and some other particular settings, that evidence is weak one way or the other, but we'll keep it under review. A
quick thought on Brexit before we let you go. I know that we're almost out of time. Why don't we put these trade talks on hold for a bit? We are a bit busy as a world at the moment.
Yeah, but we don't need to. So, gosh, it's a while since I've discussed Brexit on one of these programs. There's absolutely no need to. I think we can. The basis of the future arrangement is already set. We can get the details in place. There's no reason to delay. I think we should just get on with it. But honestly, it isn't something that I'm spending any time on personally at the moment because we've got this coronavirus to deal with. But it doesn't need any time because we've got the basis of the agreement. So let's get on and implement it.
We have had thousands and thousands and thousands of questions for you for tomorrow. Ask the Health Secretary, 10 o'clock, Sky News. We don't have time to ask all of them for you. Why do you think it's so important to take questions directly from the public?
Well, I do. I think it's really important because there's so much about this virus that's new. There's so much about the circumstances we're living in that's new, and my colleagues and I are taking big decisions every day about how we manage our way through it, and we take the best decisions we possibly can. But we also want to hear from you and your, the viewers of this program. And so, whether it's at the daily press conference with now questions both from the media and members of the public. Also online, I do Ask Me Anything sessions, but I think I hope we have a really good session tomorrow with questions from the public because the public, as you say, have got so many questions and totally understandable, and I want to be as open and transparent as I possibly can be.